Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. And get started. So welcome everyone. My name is Christina Rollins. I am the Chief Operating Officer here at FU Cancer. Dr. Shelby Ezeko, our founder and CEO, is also on the line, and we are so very thrilled to have our dear friend and colleague, Stephanie Dobak, joining us today to talk about palliative care. Stephanie is a clinical dietitian at the Jefferson Weinberg Amyotrophic Lateral Sclerosis, or ALS Center in Philadelphia, Pennsylvania. Prior to this position, she was the nutrition liaison for the palliative care team at Thomas Jefferson University Hospital. In this role, she provided insight into challenging cases involving nutrition support at the end of life. Stephanie is a terminal illness-related researcher, has presented nationally on the topic of nutrition and ethics, and has authored multiple nutrition-related publications. And a fun fact, Stephanie and I first crossed paths over 10 years ago when we co-authored a book chapter on nutrition and acute lung injury. And we've just been best friends ever since. So Stephanie, thank you so much for joining us today at FU Cancer.
Thank you for having me. I'm super excited to meet with you guys and talk about palliative care.
So I wanted to start with what I really think of as the elephant in the room when it comes to this topic. So what is palliative care and how does it differ from hospice?
That's a loaded question, and I think a lot of people use these terms synonymously, but they won't. So I'll break it down. Palliative care is the branch of medicine focused on improving quality of life for people with serious illnesses. And that could be heart failure, chronic obstructive pulmonary disease, or COPD, neurological diseases like Parkinson's, dementia, and yes, why most of you are here today, cancer. Palliative care is available to anyone with a serious illness, regardless of their age or treatment options or which stage of disease they're in. So it's not just for older adults, it's for children as well. It's not just for people at end of life. We typically see palliative care being offered alongside curative treatments such as chemotherapy or radiation or surgery. And the essence of palliative care is providing professional help to allow people to live more comfortably despite their serious illness. There are four major components, and the first one is symptom management. They also have advanced healthcare planning. They meet the needs of social, spiritual, and psychological support, and also caregiver support as well. Some people receiving palliative care recover from their illness, and that's great. That's the goal. And others may eventually become eligible for hospice care. Now, hospice care is under the umbrella of palliative care, but hospice care is exclusively for people who have a terminal illness and are approaching the end of life with an estimated life expectancy of 6 months or less. So, the key differences between palliative care and hospice care is first the treatment plan. With palliative care, again, a person can continue curative treatments. Whereas with hospice care, this is for people who either no longer want to pursue treatment or whose illness has stopped responding to treatment. The second difference is the length of eligibility. So people are eligible to receive palliative care for as long as they have a serious illness. So this could be years. Whereas again, hospice is for those with an anticipated life expectancy of 6 months or less, that you can continue to requalify after the 6 months. A third difference is the medical team. A palliative care team does not replace the person's usual medical teams, like the oncology team. The palliative care team works in collaboration with these other teams. Conversely, hospice care usually does replace the patient's previous medical team, although a person may still be able to reach out their palliative care physician and be seen under them while they're receiving hospice care. And the last difference is the frequency of care. Palliative care happens on an as needed basis. So a person may only get it intermittently when their symptoms warrant more support. Whereas hospice offers ongoing care until a person passes away. And this care could be on a weekly basis, even could be on a daily basis if there's a lot of symptoms that need to be gotten under control. Both palliative care and hospice care can happen in a variety of settings. And usually it's the person's primary setting. So either the home, which is the most common setting, a long-term care facility, even in the hospital. But in summary, palliative care and hospice care have many similarities, but they're not one and the same.
Steph, when should a person consider palliative care?
Great question. Anyone at any stage of their disease or treatment can receive palliative care, but I personally recommend considering palliative care if you are struggling with symptom relief. So you have nausea, vomiting, insomnia, and pain that's uncontrollable. If you've had repeated hospital or ER visits, so constant dehydration and going to the ER for IV fluids, or again, pain that is struggling to be managed at home, or if you need guidance and help with planning your future medical care. I think those are all good ways in which you could start considering palliative care.
So, if a person or a family opts for palliative care, does this mean that their other treatments are discontinued?
And I know I talked about this a little bit, but no, opting for palliative care does not mean discontinuing other treatments. Again, you can still get curative treatments such as surgery or chemo or radiation while receiving palliative care. Once one enrolls in hospice, again, the curative treatments are generally discontinued and the treatments are shifted to comfort focused treatments to manage symptoms. The one exception to this hospice rule is for children and young adults up to the age of 21. They can continue to receive curative care, or what we call concurrent care, while they are on hospice. But for example, let's just say we have a person with cancer undergoing active treatment. So they're getting chemo or radiation, but they have a significant amount of side effects. They may opt to receive palliative care for symptom management and support throughout the course of their illness. But then their cancer may get up to a point where it's no longer responding to treatment, and they may opt to stop pursuing curative treatments and transition from palliative care to hospice care. So sometimes there's a segue from palliative care to hospice care, but not always. Some people start and end with palliative care, and some people go straight into hospice care.
And who is typically involved in providing the palliative care?
So the palliative care team is huge. It has multiple different professionals that work with the patient and family, as well as the patient's other medical teams to provide physical, social, emotional, and spiritual support. The typical core team is composed of a palliative care physician or nurse practitioner. Also, nurses and social workers are key to the palliative care team. I'll give a shout out to dietitians since I am one. Chaplains play a big role. They're a huge component in providing emotional and spiritual support, because we know this isn't typically just a physical disease. It also impacts everybody psychologically and spiritually. Pharmacists play a big role. There's a lot of different therapists that might be on your team. So physical, occupational therapists, respiratory, even music and art therapists might be part of that palliative care program. And then volunteers play a huge role as well. Who all is in the person's care team depends on their needs and also which members that specific program provides.
And how does palliative care in particular improve a person's quality of life?
I just love palliative care, and I feel like there's so many different ways it helps in improving quality of life. I think the first one that we had briefly talked about is symptom relief. So if there's pain, nausea, depression, anxiety, loss of appetite, poor sleep, any other distressing consequences of the illness, they can be treated with palliative care. Palliative care providers also play a huge role in decision-making support. So making decisions about medical care, this can be difficult and overwhelming in general, but especially when you're dealing with everything that comes with a serious illness. Palliative care teams can help people understand their available treatment options and the associated risks on an individual basis. And they can also help with creating medical documents. So living wills or designated power of attorneys, they can help get you those forms and help you fill them out. They also help improve quality of life by addressing psychological, emotional, spiritual support. So we know many chronic conditions can cause fear, anxiety, depression, or confusion. So, palliative care provides counseling, it offers support groups, interfaith chaplains to discuss spiritual questions. And they can also discuss medical options as well to address any sort of psychological challenges. It also provides caregivers with respite care. And this allows caregivers to get a much needed break to rest and recharge. So I think that's a huge benefit for both the caregiver and the patient. And it also offers bereavement and counseling and grief support. We know so much of medicine, again, focuses on the physical aspects of the person. So I really love how palliative care addresses the whole person, including the psychological and emotional and spiritual aspect of it. The last major way I think that palliative care can improve quality of life is the coordination of care. So, again, the palliative care team is often provided alongside other medical care and treatments. So, it's this extra layer of care outside of treatment, focused again on the whole person. We call our palliative care team the boots on the ground because they visit the home, they see different aspects of the person, their family, particularly their social situation, and then they coordinate the care with the other medical teams. And they really advocate for the patient. They help set up valuable community resources such as support groups, financial assistance, and caregiver support. So I think there's so many aspects of palliative care that can improve a person's quality of life.
Well, it sounds like in a time where somebody may be overwhelmed with so much medical information and different things happening, very stressful. So it sounds like palliative care offers really an advocate, somebody who is trained medically and can help you navigate through this challenging time.
Sure.
So, Steph, what advice would you give our listeners who are maybe considering palliative care but just don't know where to start?
I would suggest considering it sooner rather than later. If your doctor tells you that the type of chemo or radiation you'll be getting is associated with a good amount of symptoms, ask about getting palliative care involved early on. Logistically, to begin palliative care, a person usually needs a healthcare provider to give them a referral to a palliative care specialist. And financially, know that most private insurance plans cover palliative care and hospice care. However, there might be copays, so check with your insurance company to verify coverage. But Medicare Parts A and B, Medicare Advantage plans, Medicaid, they all cover both palliative care and hospice care. But some questions I recommend a person talking with potential palliative care programs about, and you can set up informational meetings with each of them. So it's kind of like an interview. So ask them, will you take my insurance and what does my insurance cover? What specific services might I be eligible for? If I get palliative care and later need hospice care, can I get it from your program? So some programs are just palliative care, but a lot of them have a hospice component too. So that way you can just segue over and keep with the same company. I recommend asking, what therapy or medical coverage will I gain or lose if I enroll in something like hospice care? So, hospice care gets a certain amount of dollars each day, so they can't spread it out. So, a lot of different services they might not be able to offer. So, sometimes we recommend our patients get set up beforehand before they enroll in hospice, so they make sure that they have all that equipment or services or whatever they need. And then the last question I recommend is asking, how available is your team? Do you offer 24/7 care or you're only available during business hours? Because I think a big component of palliative care or hospice care is that ability to reach providers outside of normal office hours. But lastly, I just encourage people to shop around. Sometimes a palliative care or hospice team or a certain provider within that team isn't a good match for you. So know that there's plenty of options and to really explore those options if you need to.
All right. Well, Stephanie, again, thank you so much for joining us today. It's always a pleasure talking with you, and I really appreciate everything that you're doing for our nutrition patients. Listeners, be sure to visit our website at fucancer.health to learn more about holistic cancer care. And be sure to like and follow our podcast on Spotify, YouTube, or wherever you access your favorite content. Until next time, I'm Christina Rollins. Thanks for listening.